Can we start my talk, please? What I will do is to change it slightly and maybe have a friendly talk with the two of you, because the main idea for me for this talk is to disseminate the information to the, I'm talking to them. Anyway, I'll talk here. So disseminate the information to the local graduates. So it's probably best to talk to you, then you can talk to hundreds more people rather than me talking to one person. I mean, you can still learn and you can ask questions. But I'll just let you, give you my perspective about how things work and where the UK training should be in the psyche of the people here. So first of all, so can I maybe thank you and congratulate you. I mean, by accident, my close senior and colleague, Pranav Ranjan, he dragged me, he said that, come, my daughter is giving a talk somewhere, let's go. And then on the way I said, okay, what's the talk about? So training in the, training opportunities after residency, something like that. I said, well, that's interesting because my talk is similar to that. And thus I went to your talk, and the whole room was full. There was no sitting space. So I mean, you saw me, for the whole talk, I stood near the wall, me and Pranav Ranjan, and brilliant talks. So the interest is there. Unfortunately, this talk was arranged at the last minute. It's not arranged well, even the title is not there. But if I can give you my view, then you can disseminate because the interest is there. And I want people, the young people, to make the most of it. I mean, this route is probably not suitable for everyone, but whoever is suitable for that, if they know about it, then they can come and make use of it. So you're probably the best conduit for this. So I will change the tack of the talk. It won't be very long, about 10, 15 minutes. So, disclaimer. We can, next time, I mean, the Royal College will be interested, but this time we didn't have time. But next time we can get it sponsored by the Royal College, then it will be official and formal. Because I'm a Royal College FRC of the examiner, and Sanjay ji is clinical lead, and he's involved. So, and the Royal College wants people like us to take it forward. So we can be with the, and then through me and Sanjay ji, you can be linked to it as well. Because the problem there, even for me, is that I don't know who are the good people in India and who are interested. So this could work out quite well. And it's a win-win situation. It's good for the UK workforce and the UK Royal College, and it's good for Indian training and India as well. So it's a win-win situation. But anyway, this talk is not sponsored by the Royal College. So Sanjay ji's talk was about how to get into the UK. My talk is about when you're in the UK, how you should make the best use of it. Because if you're there for 5 years, you stay there, you come back, but make the most of it. If you don't make the most of it, then you are like a general ophthalmologist. It's not good. As you said, I mean, exactly right. You have to be a specialist. Then only you will thrive there or here or anywhere in the world. Now, it's half humorous in a way that if you go there, you find a job, then you have enough money to enjoy your life. So you can go partying, you go womanizing, partying, drinking, drugs, whatever you want, you can do. Now, I would suggest the second option. You do your career progression, you consider the career, and do all that as well. It's not either or all. So, have the focus right.
Do you need a double sponsorship for that?
Well, you need two people anyway. Now, on a more serious note, so the career progression in UK means becoming substantive consultant like me and Sanjay ji is. So once you are once a substantive consultant, then you have much more authority. So you can go and anyone of you can go and work as a locum consultant, but it doesn't have the real authority. So anything on top of that, like clinical lead, the medical director, this lead, this council member, you can only be there if you are a substantive consultant. So when I say career progression, we should work towards substantive consultant. And working towards substantive consultant, you will have to get the training. So you can't become substantive consultant by someone's parody or you're just bootlicking someone, you just cannot. So you have to reach that certain level to become substantive consultant. Then beyond that, I mean, if you become super specialized or you become in the management, you can do anything. But you have to be at that level to become a consultant. So when they say career progression, we should try to, the juniors should try to become to the level of the consultant. Now, if you want to come back, so to become a consultant, the only requirement that you have to be in the specialist register. So when you say register, say you have to fulfill all the criteria, you go through all the process, so you have to do the FRC exam, you come to the register. So that's the only criteria. So I'll go through how to get into register. So specialists are the only two routes. So for the local graduates, we spoke about it yesterday briefly, isn't it? So you get selected, you do 7 years of training, you pass your exams, you do your portfolio, and you become registered. It's like a routine, like doing residency here. Once you're in the residency, you do all your things. After 3 years, you pass. So that's the standard route. And that route was the only route up till about 20 years ago. So when I went there in 91, or 34 years ago. So for us, that route didn't exist. So very few Indian people became substantive consultants there. But they opened it about 20 years ago. So that's how the alternative route is how me and Sanjay ji, we got into the specialist register. I became consultant up 2008. So that route is open for people who want to stay. Even if they want to stay, that route is open. So the alternative route. And that's called CSER. So CSER means certificate. You get certificate of eligibility for specialist registration. Now, essentially, how the CSER works is that if someone can demonstrate that they have the same skills as the local candidate, then you will get the CSER. So that's the foundation, that's the basic of how the system works. So if someone understands how the normal system works, then you just have to do all the same criteria. So I'll just go briefly about the normal system. So the normal system, as I said, the 7 years training, there's a curriculum, there are clinical and surgical requirements. You do all the clinical surgical requirement, you build up a portfolio, and in that 7 years, you have to do all the FRC of the exams. And so that's essentially the criteria. And those 7 years, as Sanjay ji also alluded to, you go through all the subspecialties. So at the moment, there are 12 subspecialties. And the normal SPR, the registrar, will go through all the subspecialties. So when you become a substantive consultant, you have got the basic knowledge of all the subspecialties. So that's one good thing. And that's also you have to do in your portfolio as well. Now, the other thing also is that for the CSER application, only last 5 years of experience is counted. But there are exceptions to it. And then you have to do everything that the registrar does. And the process is quite straightforward. So you fill up a form, demonstrate that you have all the eligibility. It goes through, you apply to the GMC, and one of the clerks will screen it. So that's non-medical. So they will have a criteria, and they will screen. And then once the screen is okay, then it's sent to the two assessor. And then both assessors say that it's okay, then you get a registration. So important thing here is to go through the GMC and the Royal College guideline and tick all the boxes, because the clerks will only tick the boxes. So don't miss, you know. So first stage is just ticking the boxes, go through all the guidelines, and then, but success rate is 50%, which is quite good. And the same application, if you don't succeed, they will write back to you, okay, this part is missing, and then if you do that part within a year, then you can just add it to your application, and then it will be considered second time. And then in the second time also, if you fail, then you start the whole process again. So there's no limit to how many times you can do. Now, generally, so I would say if you was advising your juniors about it, say it's a two-step process. You do FRC opt first. Now, again, what I would suggest is I wouldn't say no point in doing FRCS Edinburgh, Glasgow, and Ireland, because if someone is sitting the exam, you sit college FRC of the exam, the other exam as well. If you don't get FRC of, you got FRCS Edinburgh, you can still get the GMC registration, because the first criteria that you get GMC registration, then only you can work there. So if you get FRC Ed, but don't stop there, you know, get your registration, start working, but do the FRC Opt, because without FRC Opt, there's no career progression. So I think that's the important message I was trying to give yesterday.
Is 2 to 3 years following their residency period?
No, I would say 2 to 3. It will take 2 to 3 years time, because if someone is brilliant, I hope you are brilliant, you can clear it in 3 months.
So you need to go through the exam?
Yeah, to clear all the exams. Yeah, and then if they're interested, they can do the part 1, as you mentioned. You can part 1 refraction from here, and you can do all the exams from here. But generally, on an average, it takes about 2 years to do. Then after the FRC Opt, to get through all the process in the Caesar portfolio, takes about 2 to 3 years. So on the average, about 5 years. But if someone is brilliant, they can do in 2 years or 1 year. Now, I will give you my view. I mean, you probably are more just because I only know about the UK system, a bit about the Indian system. I don't know about the other systems. But I think it is well worth it, because if you return home and you are a well-grounded clinician and surgeon, you will do well anywhere if you come here. If you get into the specialist register, you can always go back to UK. You have no problem in getting a locum. It's very lucrative to do short-term locum, agency locum, as you say it. So you have the win-win situation. You get trained, you get the specialist. You come back here, have a good established practice. You go back, you liaise with the Royal College. If you stay there, then there's no other option. I mean, if you want to carry progression, you have to do it. So whichever way you take, there are only 2 ways: either you come back or you stay there, or you go elsewhere. If you have a special registration, then it's useful. It's very beneficial. And at the moment, there is good, as Sanjay alluded to, there is a severe scarcity of good doctors. So if you have GMC registration, then you can walk into almost any unit and find a job. You won't find a substantive job, but you can find a job. And that will not last forever, because the government there have, at the moment, there are 7,500 medical students seat every year. In 6 years' time, there'll be 15,000, so they're doubling the medical students. So once they come out, they will always have a preference over overseas doctors. So in about 10 years' time, I think this opportunity will dry down. So if someone wants to go, now is the time to go. So it's a very good opportunity. So that's for you. If you want to go, don't delay it. So, you know, as you would say, if you want to go, put your 100% effort in it and do it. It's not difficult. Now, for Indian doctors, we are intelligent, we are hardworking, we just don't have enough spine. That's the problem. Yeah, we just need to develop some spine. Now, there's lots of help available. As you say, I mean, the 2 of us, I have nothing to gain with this. I put in so much effort, Sanjay has put in so much effort, and there is, you ask any of the seniors, we were always willing to help. But formally also, the Royal College People don't realize it. The bureaucracy in India is still awful. But if you write to Royal College, write to GMC, they may say no, but they will always reply to you and reply politely. And if you have a genuine question, they will also show you the way. But this is the reason I'm not happy to do it, but if you do this, we will do it. And there is no parry, nothing. I mean, if you got the merit, you will get it. So it's quite straightforward. And their website is also very good. So all the information is there. And if there's something not clear, just write to them, email them, and they will reply. It's very, very good. Now, there also some like ophthalmic, SPR training is 7 years. Some units are doing training program for the overseas doctors. So that's also coming up. As I said, I mean I think that's, Rashmiji, yours talk was about this, isn't it? That you have to work hard and something similar to this. So my advice would be that you go there. I think even if you have got good training here, in the UK, it's not only about the hard clinical and surgical skills, it's about the soft skills as well. How to talk to people, how to be polite, how to be honest, how to be punctual. I mean, even after 35 years, I am not punctual. So that's the problem, I'm still learning. So there are lots of soft skills that we learn as well. And how to talk to the patient, and that's the problem so important. I mean, I see my colleagues talking and scolding the person, my heart sings, So there's not only the clinical skills, surgical skills, but the life skills as well. So I think I would encourage everyone to go there. If you want to go for work there, just doing the observership is just a waste of time. I mean, we can do it online. What's the point of spending 3 months, 6 months there, just sitting there doing nothing? So, yeah, do a fellowship. Well, do the whole thing, I would say. Right, I mean, well, I'll clap for myself as well. Now, can I just say one thing here? I'm a follower of Ramakrishna Mission. And Swami Vivekananda, everyone heard of. There are other 15 direct disciples of Swami Vivekananda. One of them was Swami Ramakrishnanand. And he was the head of Chennai monastery. And at the time, I'm talking about, so he had a weekly talk. So once he went there, and there was no one, not a single one. But he still gave the whole talk, 1 hour talk. And I was just amazed. He said that it's my duty. Sri Ramakrishna Paramahansa asked me to do this, so I'm going to do my duty. And see, he gave a talk to an empty auditorium. And that, I never forget that incident. And that's a true incident. But at least I have 1, 2, 3, 4, 5, 6.
Alok, the other thing which you were alluding to, Rakesh Singh policy in UK works very well. You want to mention that?
Honesty, well, this is joke. One of my friends who was notorious, he was notorious for being very tricky with everything. So he went to UK, and after 6 months after him, Walter was he's a classmate. He went there. So on the airport, when he picked him up, he said, okay, well, I'm coming to work here. What's your advice to me? He said, honesty is the best policy. Now, he's the last person someone would expect to be honest. He was a cookhead and doing all sort of nefarious things. And, we are from Bihar. And he was the top Bihari. He was the top dog there. And he said, honesty is the best policy. And that works. That works there immediately. In that context, I would say that, let's say we're not overrunning our time. So in that sense, I would say in UK you have to be honest. Because if no one expects you to be dishonest, but if you're caught being dishonest, there's no escape. Even the cabinet ministers, they have been jailed, not only expert from jailed, for saying that they were not driving the car when they were caught on the camera. His wife was driving the car, And both of them went, and the wife said, no, I was driving the car, but where actually he was driving the car, and somehow it was proven. Both of them went to jail. So honesty is actually the best policy. But even here, in the long term, honesty is the best policy. Yeah. Thank you.
I don't think we'll have any questions. You have any
No, I mean, how can we assume that? And we might, not a question, but we might discuss it with our colleagues here.
We still have, what time are we supposed
We've got 15 more minutes.
to 10
Yeah.
minutes, so yeah.
How do you finish all your requirements after you go there by finishing your FRC?
Sorry, so
Listen.
there's only five of us, but yeah.
Oh, his guest lecture is still, sorry.
Oh, sorry, I beg your pardon.
No, no, it's a pleasure.
Yeah, okay, well, let's answer his question first. Give us 2 minutes while you set up.
Yes, absolutely. Go ahead.
So how do you finish all your requirements after going there by finishing your FRC? Of like you have shown 12 subspecialties and you have to show competence in each specialty,
So there
right?
are stages. So first you have to get the GMC registration. So have you got your fellowship, FRCS?
No, I am planning to write.
No, he's talking about the components, the modules.
Yes.
Modules.
Yes, you have to finish off
Yeah.
lot of
So
boxes.
if you go on the college website, so you look at what the requirement is for the local registrars.
I would expect that maybe if you have a logbook which proves that you have good adequate exposure,
It is
let's
all-
say in 6,
So
and
whatever-
other 6 maybe we can go through.
Whatever
Maybe-
surgical and other skills that you have, you take the evidence from here anyway, because if it's within 5 years, it will be counted. But I spoke to his name is Robert Holston. He's one of the key people in the Royal College who deals with the Caesar application. And he said that if you apply based on only your overseas experience, even though you might fulfill the criteria,
Still have-
it's difficult. You have to have at least, he said at least a year in service in ophthalmology UK, and I've used that experience in some of the modules as well. So a lot of your modules will be completed based on your experience here. You don't have to do all the work. But there may be some which you may have to do there. And things like Alok's slide show, the audit cycle, those bits of the audit, or if you manage to publish something, or if you got any publications within 5 years here as well. Those are things which you will need to, and the forms that you require to fill in these days, I think it's electronic and nowadays it's
Yes, just to expand on that, if you go on the college website, there is all formalized about what events you have to do. So there's 4 levels of it. So level 1, 2, 3, and 4. So level 1 is like, can you use the slit lamp, can you use the indirect ophthalmoscope. Level 2 is, can you do cataract surgery. Level 3 is, can you do complicated vitrectomy in the cataract surgery. So it's all formalized, and you have to get a form signed off. So you come to me and say, Mr. TEKRIWAL, can I get signed off with the slit lamp examination? So if I know that you can do the slit lamp, I will sign it. Otherwise, I'll get you to demonstrate it. So it's like that, you have about 200 forms to fill in. You have to demonstrate it, get it signed. So that way you build up your portfolio. So they're all formalized. There's
I think you've done your FRC off. You manage to do his FRC off. A lot of those skills are automatically, you don't have to, there's an exemption.
Yeah. So there's a process. There's a quite formal process. But the first thing is that if you go, you can only do it.
Go ahead.
Go ahead.
Yeah, go ahead.